Good afternoon. My name is Kate Cardone. I'm a licensed clinical social worker and doctoral student in social work. I'm also an advocate for youth mental health. Today, I'm going to be touching on some difficult topics, so please step away as needed. Actress Glenn Close said that what mental health needs is more sunlight, more candor, and more conversation. And I could not agree more. With that in mind, today I'd like to talk about the relationship between social media and teen mental health. Over 90% of teens regularly subscribe to at least one social media platform or application, such as Instagram, TikTok, Facebook, or Twitter. 1/3 report being on social media almost constantly. Teens' on and offline lives are woven together, and the lines are increasingly blurred. For 12 years, I worked providing educational programs to teens focused on depression awareness and suicide prevention. When speaking to groups, often several hundred teens, I'd ask, raise your hand if you feel social media's impact on your life is negative. Inevitably, a huge number of teens would raise their hands. My next question would be, how many of you feel social media is positive? Again, a lot of hands would go up, sometimes even the same ones. While teens were very open about the negative side of social media, many also told me they use social media to connect and to reach out for help in their darkest moments. For some, it was life-saving. So, is social media good, helping teens connect and find community? Or is it a dangerous source of misleading, false information, contributing to increasing rates of depression and anxiety? Research seems to say yes, and also yes. Like the Facebook relationship status, it's complicated. So today I want to talk about what research actually says about this relationship and what we can all do with that important information. But first, let's talk for a minute about teen mental health today. Headlines raise the alarm about a youth mental health crisis. And while I'd like to tell you that's not the case, unfortunately I can't. We should be alarmed and we do need to respond. Between 2012 and 2018, there was a 34.6% increase in the incidence of mental illness among children ages 4 to 17 in the United States. The World Health Organization estimates that roughly 14% of young people worldwide are impacted by mental health disorders, most commonly depression and anxiety. Depression is a mood disorder characterized by feeling sad, irritable, empty, or hopeless for more than 2 weeks, and those feelings impact your daily functioning. Anxiety disorder is characterized by persistent apprehension about real or perceived threats, and those feelings also interfere with daily life. The Center for Disease Control and Prevention's Youth Behavior Risk Survey reported that in 2021, 4 in 10 high school age students felt persistently sad or hopeless. Almost 1 in 5 seriously considered attempting suicide, and 1 in 10 actually made an attempt. Suicide rates have increased annually since 2007, decreasing for the first time in 2022. However, suicide is still the second leading cause of death for young adults in the United States, with over 6,500 young people between the ages of 10 and 24 dying by suicide in 2022. And I want to pause there for just a moment because it can be really easy to gloss over big numbers, but that statistic really hits me right in the heart. I lost my younger sister, Rebecca, to suicide at the age of 20, and I immediately think of the parents, the siblings, the family members, the friends, of everyone that is feeling ripples of grief and loss. Experiencing a mental health disorder dramatically increases a teen's risk for suicide. Over 90% of young people who die by suicide have a pre-existing mental health disorder, and most commonly that is depression. So preventing teen mental health disorders can quite literally save lives. And when we talk about adolescent mental health, we also need to acknowledge that not all youth are at equal risk for mental health disorders or suicide. While the suicide rate for teens overall decreased in 2022, for the first time the rate for Black teens surpassed that of their white peers. Also, females and youth who identify as lesbian, gay, bisexual, or transgender are more likely to report suicidal ideation and attempts. So where does social media fit in this crisis? Research does raise some pretty serious concerns. Uncontrolled and compulsive use of social media has been associated with sleep problems, attention problems, and feelings of exclusion, All of those are connected to an increased risk of depression and anxiety. Teens may experience bullying online or cyberbullying. That's defined by the American Psychological Association as verbally threatening or harassing behavior conducted through electronic media. Teens may also be exposed to troubling content and misleading or false information. Targeting algorithms such as TikTok's For You feed flood young people with troubling content. The Center for Countering Digital Hate's investigated the nature of TikTok's algorithm by establishing new user accounts and setting the user ages at 13. These fake accounts received self-harm and eating disorder content within minutes of scrolling on TikTok for the first time. When users responded with likes or views, they were then bombarded with content about body image and mental health as frequently as every 39 seconds. Social media can be a dangerous source of misinformation for teens who are not ready to filter and evaluate huge volumes of opinion and possible misinformation. Social media can also fuel teens' fears of missing out. It can amplify false and damaging messages, and it may lead teens to despair of meeting unrealistic ideals. After all, how can anyone's everyday reality compare with someone else's highlight reel? A few years ago, I found myself unexpectedly getting a lot of negative online feedback. One morning, I received a text from my husband that said, "Gianna's in the paper. Look at the comments." So I clicked on the link in his text message, and there was a story from our local newspaper about some extreme cold weather we'd been having. Above the article was a photo of our daughter Gianna and a friend who they were standing at the bus stop that morning. The article was fine, and then I looked at the comments. Commenters were angry, and a lot of that anger was directed right at me. They were upset Gianna was not wearing a hat or gloves, that she was wearing jeans. One comment said, "Clearly this is a working mom who did not have time to wait with her daughter at the bus stop." Another comment lamented that parents in her day would never have just left their children out in the cold like that. Now, clearly, I'd suggest none of these folks had ever tried to convince a middle school girl to wear a hat, gloves, or snow pants. None of them knew our family or me or anything about the situation beyond that one photo, but they felt very comfortable commenting just the same. And I gotta admit, those opinions didn't feel great. For all of us, having our lives visible online brings with it a risk, and that's incredibly important to consider when we're talking about already fragile teens. But before we start grabbing the phones from our teenagers' hands, let's talk for a minute about the benefits of social media. Research tells us that social media also provides spaces where teens strengthen relationship with their peers, where they develop their identity and express themselves, where they find validation and positive reinforcement. The connection and belonging found online can reduce loneliness and support emotional well-being. Defining individual identity and figuring out where they fit within peer groups are both really important developmental tasks for teens, and social media, at its best, supports both. In fact, 58% of teens say social media makes them feel more accepted. 71% say it offers a place to share their creative side, especially for teens who are part of groups marginalized based on race, ethnicity, sexual and gender identity, and disability. The social connection offered online can help reduce the impact of outside stressors. It can protect teens by providing a critical space of belonging and support. Social work researcher Brené Brown, who wrote the wonderful book Daring Greatly, says that we are wired for connection. We thrive in community. And I believe that we can all play a role in building a brighter future for teens that includes positive and healthy online and real-life community and connection. So I encourage you to engage, invest, and advocate. First, engage. Talk to the teens in your life and in your community about how and why they engage with social media. Invite them to teach you and share their online lives with you. A few questions that could be a great starting point are, what's your favorite social media app? And why is that your favorite? I read a lot about the negative side of social media. What do you think about that? Do you ever feel worried about what you see online or what you see friends sharing online? Second, invest. Engage with youth-serving organizations to support a community that's caring and connected. Give your time, your talent, your funds, be creative. So, a lot of chapters of the United Way host an active database of local volunteer opportunities. You can reach out online at unitedway.org or search for opportunities near you. Local schools and faith organizations also often need volunteers. Schools use volunteers for things like tutoring programs, and a lot of churches welcome adult volunteers to support their youth programs. Or create your own opportunity. My good friend Jen, a Navy spouse, realized that young sailors were at times struggling aboard ships. Jen is a huge dog lover, so she got connected with a great nonprofit in Virginia Beach, Virginia called Mutts with a Mission, and she began an initiative to bring service dogs aboard Navy ships. This is Captain Sage. She is the first working dog aboard a U.S. aircraft carrier. Working dogs are now deployed on several Navy ships where they bring smiles, and most importantly, they open opportunities for conversation, connection, and check-ins with sailors. Finally, advocate. Advocate for legislation that limits some of the most dangerous elements of social media. One of those is the black box algorithms, those hidden programs that determine what content you view, like TikTok's For You feed. Those operate behind the scenes, often without our consent or knowledge, and they're really important. Another dangerous element is infinite scrolling. That makes it possible to keep scrolling through never-ending content where you never hit a natural endpoint. That element of social media leads to lots of passive social media consumption where users are just viewing content rather than engaging actively with peers. And that's been connected with compulsive use and also increased feelings of loneliness. Overall, legislation should require increased transparency by social media companies regarding the ways the user experience is being shaped, and it should offer teens and also adult users more control to opt out of potentially harmful settings. Legislation should also support collaboration between social media companies and researchers. Teen social media use changes quickly, so access to timely data and the ability to partner with social media companies to increase our understanding of how it's impacting teen mental health, and at the same time craft interventions within the platforms to address some key concerns is really important. It's also critical that we challenge legislation that might, even unintentionally, limit access to important information for some of the youth who need it most. If you'd like to learn more about how legislation can protect teens on social media, I highly recommend reading the Center to Counter Digital Hate's STAR framework. Their 4 guideposts, safety by design, transparency of algorithms, rules enforcement and economics, accountability, and responsibility, are informative and really thoughtful. Through advocacy, we can support teens to safely navigate these waters by preserving the best aspects of social media, while at the same time advocating for legislation that places checks on its most dangerous components. Together, we can build a brighter future for youth by supporting teens to safely navigate social media, while at the same time creating communities on and offline that are connected and caring. Thank you.